Ryan? Okay. So what we'd like to do is give you a presentation. Dr. Askew will lead it off and explain what we're doing with an equity vaccine plan. And then Caitlin Murphy from the Health Department and then Ryan Middleton from the Office of the County Exec have a joint presentation. And then we'll hold questions to the end if that's all right with everyone. All righty. I'm going to turn it over to you, Dr. Askew.
Ria, thank you very much, and thank you all for joining us today. I also want to give a big thanks to Ryan Middleton and Caitlin Murphy for pulling this together for us. Part of the, I've had the great pleasure to be in contact with many of you on the line today about what's going on with respect to equity, in particular with the vaccine rollout. I think we've made some great strides, and a good bit of that improvement that we've seen here in the county has really been based on the work of the vaccine equity team. And so I'm often getting asked, well, what are you doing? Are you going here? Are you looking at barbershops? Are you looking at salons? Are you going to go to schools? Are you looking at laundromats? And, and when I say, yes, we're doing this, here's where we're going. I don't always have that information right at my fingertips, but the people who do are Ryan and Caitlin. And I wanted to give them the opportunity to specifically talk about the strategy that's being used and also be available to answer questions. And not only answer questions, as always, this is a partnership here in the county. So one of the things that I really enjoy about talking with many of our elected officials is that we get the opportunity to get ideas, things that we haven't thought of. I think we've covered a great deal of ground in terms of the things we've thought of and the places we'd like to go. But there's always new ideas out there, and we welcome that as part of our discussion after the presentations. Again, I think we've made some great strides. We're going to continue to do even better. This is where, we thought the vaccine rollout in general was the heavy lift. I'm actually of the mind that this is the heavy lift. This is where we get at that last, 5 to 10 to 15% of folks who are willing and anxious to get vaccinated so that we can be in a good place this fall. I call this trench warfare. You're moving trench to trench now. We're not covering big pieces of land. We're covering small pieces of land. But with each small piece that we cover, we're moving forward. So we're having events where we're hitting, 20 people, 10 people, 50, 150, 200 people. Those are the kinds of events we're going to be having in the future and through the rest of the spring and summer as we move toward the fall. So with that said, I know there's a lot of ground to cover today. I'm going to turn back over to you, Ria, for whoever's going to be up next between Ryan and Caitlin getting us started with the presentation. And again, thank you all for taking time out of your busy days.
And thank you, Dr. Askew, for doing all the work that you and Dr. Carter have done to lead us in this direction and getting to this point. The numbers are going down and we feel safer out in the community. So the presentation will start with Caitlin Murphy from the Health Department, and then we'll go to Ryan Middleton.
Sure. So good afternoon, everyone. We are so excited to be here to talk to you today about the work that we've been doing on the Prince George's County COVID vaccine equity team. So I'll just introduce myself. My name is Caitlin Murphy. I'm the special assistant to Dr. Ernest Carter, who, as you all know, is our health officer in Prince George's County. And during the COVID-19 response, I'm serving as the liaison to external agencies, as well as the co-chair of our local equity team, along with my colleague, Ryan Middleton.
Good afternoon, everybody. Ryan Middleton. I serve as the special assistant to the chief of staff, Joy Russell, for the county executive's office. One of my duties here has been helping to guide the vaccine equity response throughout the county's vaccine distribution program. So it's nice to go over a lot of the activities we have for you. We've been doing a lot, and it was kind of crazy just to reflect on everything we have done through this presentation. So it'll be good to let you guys know what we've been up to. So we can go ahead and get started for our first slide. Okay, and please, anyone, if you're having trouble viewing any of this, please let me know and we can get that fixed. So the Prince George's County Vaccine Equity Team pretty much started as the entire vaccine program and rollout started earlier this year. We really wanted equity to be considered throughout the entire program, especially as the vaccine supply started off at a very low number. It's since increased, but we wanted to make sure we were very judicious with how we were distributing the vaccine according to phases, but also making sure that the people and the communities that were hit hardest by the COVID-19 pandemic were also being considered. Here you see a pie chart of Prince George's County's racial demographics by percent. I do want to note here that Latino and Hispanic is, for the census, is reported as an ethnicity, so you're not going to see that as listed, but Latino and Hispanic community does represent about 19.5% of the Prince George's County population. So when we first started, the county's equity team was convened to meet the following objectives. We were identifying priority areas to focus education, outreach, and vaccination efforts. We wanted to address barriers to entry to vaccination sites, things if you didn't have access to internet, if there was a language barrier, things of that sort. We wanted to make sure we were developing community outreach strategies to build trust. We wanted to make sure that we weren't just telling people like, hey, you should take the vaccine and that was it. We want to make sure we're reaching out to trusted voices in the community so that they could help provide that bridge between anyone who might be hesitant and having them get an appointment to receive the vaccine. And we also wanted to coordinate with public and private partners where we worked with FEMA, we worked with the Vaccine Equity Task Force on the state level. We worked with organizations like Luminous Health, Children's Hospital, Giant and Safeway to make sure that we were also working hand in hand to get the vaccine out there in an efficient way. And members of the Vaccine Equity Team are comprised of staff from the County Executive's Office, the Health Department, our Office of Community Relations, and the Office of Emergency Management. So one of the first things that we did was identifying where exactly we needed to direct resources. So we created what we called a zip code prioritization matrix that pretty much guided where exactly in the county there were issues regards to socioeconomic status, with regards to COVID-19 cases, with regards to how many vaccines were actually administered. And we used that data to really guide us to where we needed to go. And that dictated everything from pre-registration events that were held by OCR to mobile unit deployments. And the equity team has been in regular contact with other members in the health department, OEM, and OCR to make sure that we were accurately and efficiently reaching these communities. And prioritization matrix is updated 1 to 2 times per week and distributed to agencies and partners to make sure that they're aware of where resources have been, where they needed to go, and also so they can see the progress that's being made. And our next slide here, this is our first version of the prioritization matrix. I know it's very hard to read. I can barely read it right now myself. But the important thing is those 4 columns to the right really guided where we went. And I do also want to say that the prioritization matrix pretty much, the initial one at least, pretty much reflected our initial anecdotal observations of where we needed to go. We knew that we were going to have some issues getting people pre-registered and booking vaccine appointments in areas such as Langley Park, where there's a high immigrant population. There's people who might speak English as a second language, people who might not just engage with the government at all. So the 4 columns to the right you see are the delta between registrations, pre-registrations, and the pre-registration average. So those are people who we wanted to know where was pre-registering to receive the vaccine. This is early in March. The second column there is the delta between the vaccination average and the number of people who had been vaccinated in that given zip code. The third column there is the percent of families or individuals below the 2014 and 2018 income poverty line. And the fourth column is our socio needs index. So we use all these factors to sort of rank the zip codes to determine where exactly we needed to go in a given area. And I do also want to note that we want to make sure that these numbers aren't being kind of conflated with things like vaccine hesitancy, because we want to make sure that we also understand that there are confounding factors in this matrix, such as outreach, access, and language access as well. Okay, and I do also want to note here that as the vaccine supply increased and vaccine logistics evolved, so did our input. So when we first started vaccine education, when there's very little vaccine to distribute, we wanted to make sure that we were getting people educated, that we were having pre-registration events to get people in line so we could reach out to them so they can receive an appointment to receive the vaccine. We wanted to make sure that we were getting educational materials in the hands of trusted leaders, pastors, community advocates, elected officials like yourselves. We wanted to make sure that we were ensuring that language access was considered, such as making sure that our registration platform was available in other languages, such as Spanish. And we also, initially when we had a smaller number of vaccine inventory, low-income senior housing vaccination efforts were one of the first things that we were doing. Caitlin, do you want to jump in here?
Sure. Yeah. So as Ryan said, as our response evolved, we shifted the way that we were thinking about equity. So initially, as you all will recall, our equity focus was making sure that we were getting the vaccine to those who were most at risk of getting COVID and of dying of COVID. So that was our first responders, our healthcare workers, and our seniors. So if you look at, the first column here, that's our pre-registration. We were making sure we were reaching seniors. But then we started to shift as supply increased a little bit to doing more mobile units and temporary sites. So as different sites started popping up around the county, one thing that we did was pull names off of our pre-registration list that we were collecting and advertising throughout the county and share them with partners like Luminous or the state who are operating mass vaccination sites. And that partnership helped us reach people a little quicker. We also developed a vaccine site interest form that allowed community organizations who are interested in hosting a vaccination clinic to submit a form indicating, the size of their location and just general logistics information so that we would be able to follow up with them and coordinate a potential mobile unit event. And we made sure when we were pulling that information to look first at the locations that were in our top 10 priority zip codes. So we could make sure we were getting those mobile units out to the places that needed that extra attention. We also coordinated with the State Vaccine Equity Task Force, as well as FEMA, who both operated some pop-up events and some consistent pop-up events throughout the county. And we worked in partnership with them to push out information about it. And in the case of FEMA, to do a little bit more in terms of coordinating the logistics of the clinics. One big thing that we did was advocate for our federally qualified health centers. So I know that you all know that FQHCs are the backbone of the healthcare system. They care for our individuals who don't necessarily have the ability to pay for care. And so we really wanted, from an equity perspective, to make sure that they had vaccines. So early on, not all of our FQHCs were able to obtain vaccine directly from the state. And we stepped in and made those transfers so that they would be able to vaccinate their residents. And we also transferred to some of our hospital systems and other partners as well. And then we started to focus on a homebound program. So we were getting a lot of inquiries from elected officials like yourselves, as well as other community leaders on individuals who were not going to be able to make it into our sites who needed to be vaccinated. And so we developed a homebound program pretty early on in the response to make sure we were addressing those folks and going to their homes to vaccinate them. Do you want to do the next one, Ryan?
Sure. So as the vaccine supply increased dramatically, probably towards around April, what we noticed was the need to switch from a pre-registration program to direct registration, just to allow residents to book their own appointments at their locations at their convenience. So in addition to creating that platform, and again, language access was absolutely a factor in putting that platform together. We partnered with the Civic operations group, and we'll talk more about that in just a minute, where they are doing canvassing door to door in different communities according to our ongoing vaccine prioritization matrix, and also doing text and phone banks throughout the county, just to make sure that people are aware of the vaccine, how to get it, and actually sometimes directly registering them either on the phone, by a text, or at their door. We've also worked with our Department of Transportation to put together different transportation options to make sure people who may or may not be able to get to a vaccine site have the options. We've working with Uber. We have an entire sort of menu of different transportation options, like the bus, Metro Access, PGC Link, taxi cab, call a bus or call a cab, where basically if you need to get to any kind of vaccine site, you have the option of getting there. And then as we created our direct registration platform, we quickly realized that people also want even more convenience in terms of being able to walk up to certain sites. So we've had OCR host 24-hour vaccine clinics. I think the future of our efforts are going to be mobile units outside of high traffic areas and apartment complexes. I do see Delegate Jocelyn Pena-Melnick here, who we've partnered with to have a program outside University Gardens apartment complex, so thank you for that. We've switched to an emphasis on homebound visits, so a lot of our mobile units during the week are prioritizing people who absolutely can't leave their homes to make sure that they get vaccinated. We're working to get school vaccine events together. We've had a couple this week in the county. And another frontier here is as the vaccine gets approved for a higher population of minors, we're navigating the waters of getting parental consent for 12 to 18-year-olds.
All right, so I wanted to call attention to one of the specific success stories that we have when it comes to equity. So as I mentioned early on, we were focused on making sure that we reached our seniors, because we know that they are most likely to have complications, end up in the hospital, and to pass away in some cases because of COVID-19. So we wanted to make sure we are not only reaching all of our seniors, but prioritizing those who might have a difficult time getting the vaccine. So we worked with the Department of Family Services, and were able to get a list of our 48 senior housing facilities in Prince George's County. And then we prioritize these vaccinations at the low income and subsidy housing first, before addressing the privately managed housing. And this allowed us to make sure that we were really focusing our efforts on those places that were hardest hit first. And focusing our efforts at senior housing facilities allowed us to reach more seniors in convenient locations and reduce the barriers of transportation or mobility challenges, as well as to bypass the pre-registration process. So we know that a lot of seniors were reporting that it was a little bit difficult to use the technology, as well as a little bit overwhelming to have to come to a mass vaccination site. So we really wanted to leverage our public-private partnerships and make sure we could reach these folks in a place where they felt safe and comfortable. So because of our partnerships with Giant, as well as other pharmacy providers and the state and our own mobile units, we were able to conduct 19 clinics at low-income subsidy senior housing, 4 clinics at government-owned housing, 2 clinics at continuing care retirement communities, and 23 at privately managed housing facilities. So that is all facilities, but one who we are still working on. So we're really happy to report that as of June 2nd, over 80% of seniors between the ages of 65 and 84 have received at least one vaccination in Prince George's County. And as we mentioned, we are focusing now on homebound visits. And I'm excited to report there that we are up to reaching 80 homebound individuals a week with our mobile unit team. So we're really making progress there as well. And I think these numbers illustrate that.
Okay, and we'd also like to highlight the efforts that OCR has played, the role that OCR has played in this entire process. Like I said earlier, I meet with OCR at least twice a week just to confirm event logistics to ensure that our mobile units are reaching their capacity minimums and making sure that if there's any issue that we're able to divert any individuals who aren't able to either reach one of those mobile unit events, make sure we get them over to one of our mass vaccination events, or make sure we get them over to a mobile unit event that may be nearby. So OCR for all these events works with partners on site selection, site visits, logistics planning, marketing and vet staging, traffic flow, resource distribution, all of that. Our vaccine site interest form that we distributed to community partners, to churches, to cultural groups, municipal governments, it gets every detail for each event down to the square foot of the space that they're going to be in. We make sure that there are chairs there for anyone who may need to sit down while they're waiting to receive the vaccine. We make sure that they have the adequate reach in that community, that we have a good point person to work with in that community to make sure that each of these events are successful. We've listed a few of the churches here that we've worked with over the last couple of months, a few of the municipal governments, a few cultural groups here as well. And one of our highlights is being the first agency in the National Capital Region to host a 24-hour vaccination event where we inoculated over 1,000 residents. So I definitely wanted to make sure that we highlighted the community outreach efforts by our Office of Community Relations here. And then we can get a little bit more detailed into the Civic Operations Group. So we knew that in order to meet our equity standards that we were setting for ourselves, we really needed to meet people where they were, quite literally. We partnered with the Civic Operations Group. They're a third party that uses data that we give them, but also consumer data that they're able to get from different proprietary resources to conduct public outreach. In addition to polling residents about the vaccine, also getting them directly registered either on the phone or at their door. They also take the opportunity to ask residents if they need any assistance with any other county resources, such as food insecurity or housing needs or employment. And we're also able to connect some of those people that who answer the affirmative to those issues with the corresponding county resources. when we first started with the Civic Operations Group, one of the first things that we did was we made sure that we teamed up with them to make sure that they had our zip code prioritization matrix. So they received the updated ranking twice a week when we put it together. So they know exactly where they need to be throughout the county. They primarily canvass the top 10 zip codes in the county, going door to door, but they'll do text and phone banking all over the county. So canvassers going door to door in our top 10 zip codes, but text and phone banks are done throughout the entire county itself. And this is just some of the data here for some of the weekly report top lines. And this is another slide here as well. I do want to note on the bottom right of that second slide are some of the results. They do several passes by doors just to make sure if they miss you one day, they get you the next one. And so far to date, they've secured about 5,100 vaccine commitments. So they've been doing a lot of great work for us in the community.
All right, so another innovative strategy that we wanted to highlight is our apartment complex-based mobile vaccination effort. So I definitely want to give a shout out to the council chair, Denny Tavares, and Delegate Pena Milnick, who came to Dr. Askew with a great idea, a strategy for reaching residents in a way that was convenient and comfortable for them at their place of residence. So we did a pilot event at the University Gardens apartment complex in Langley Park, and we were able to reach 214 people. And this was just recently. So our mobile event numbers, as Dr. Askew mentioned at the beginning, are a little bit lower, now that demand is decreasing. So we were like shocked to see 214. So I think that's just illustrative that this is a great strategy. And it is something we've decided to continue with throughout the county. We have apartment complex efforts scheduled throughout the rest of the month and into next month in District Heights, Oxon Hill, Hyattsville, and many in the pipeline to be scheduled, all in our top 10 priority areas in terms of need. And we've also been able to use the COG canvassing team that Ryan just mentioned to complete several rounds of door-to-door outreach prior to the event. And we found that pushing out information in that way and making sure there's lots of flyers around the complex and stuck under doors is a great way to make sure everyone is aware that the event is occurring and that we get good turnout.
Okay, and these are some of the notable changes. This isn't the most recent one of our zip code analysis, but it is a recent one from June 3rd. Some of our most notable changes: when we first started, 20783 was by a mile our #1 code in need. Right now, it's at number 15. Bladensburg was at #2. At some points throughout this process, it was at #1, but that's dipped down to 7. I believe in the latest one, it's dipped down to 8 or 9. Riverdale plummeted from #3 down to #19, and 20784 went from #9 to 14. So that really highlights a lot of the work that's been done in some of this outreach. Also, if you remember in our the first one of these spreadsheets I showed you, to the right columns, actually all the columns, there was red towards the top. Now you see it's a little bit more evenly distributed throughout. That doesn't necessarily mean that all the work is done or everything's been solved, but you do see a lot more of an even distribution here that really reflects a lot of the work that's been done to make sure that we're reaching the people that we need to hit. And this is one of our more recent slides from our vaccine summary from the health department. Right now, 8 zip codes have met our summer goal of 65% of residents over the age of 12 to receive at least 1 vaccination. You can see 20769 has reached 80%. Of the 33 zip codes, 9 have passed the county's goal of vaccinating 65% or more. 15 have either reached or will reach the county's 57.5 vaccination average rate, which basically leaves only 9 remaining zip codes in need of additional attention, which we're definitely currently giving them. And this is where we kind of have an ask of you all, our elected officials, to really help us. You know, you guys are deeply embedded in all of your communities. You know them a lot better than we will. So if there are any community organizations, HOAs, apartment buildings, like we've previously discussed in our University Gardens event, that we can duplicate that success, please let us know. We would love to send a mobile unit out there and make sure that we're hitting all these communities that, you know, may or may not be missed by some of the data.
All right, so I want to do a little comparison of where we were at the end of March and where we are now. So if you look at this, this slide, this was on March 24th, 2021. So on the left side here, you see the raw numbers of people vaccinated. And then on the right side, you see the percent of the population that was vaccinated for each of these groups. And at that time, I will say it was those over the ages of 16. Now it's those over the ages of 12, because we did get that additional approval during this time frame. But this was the slide. This is the information that was keeping me up at night. I know it was keeping Ryan up at night. It was keeping Dr. Askew up at night. And I'm sure it was keeping a lot of you up at night as well. So we really, I think as a county, both the public sector, the private sector, elected officials, we all took this as a call to action. And over the last few months, we have made tremendous progress in closing those gaps. Go to the next slide. So if you look at where we are now, this was as of June 2nd. I don't want to give the impression that the work is all done, because it isn't. But we do see that we have closed those gaps significantly. So you'll see we're at above 45% for all the different groups in our county, and we've greatly narrowed the gaps between our different racial and ethnic groups. So again, the work is not done, but we've made strides, and I think this really just speaks to how we've all stepped up and made sure that none of our residents get left behind in this effort. Oh, and I also wanted to say that this June 2nd was the first time that our raw number over on the left here of Latino residents vaccinated exceeded our numbers of white residents vaccinated. So that was a great milestone as well.
So our next steps here, again, we mentioned, and also as Dr. Askew mentioned, this is really trench warfare in terms of so before we were kind of celebrating, 2,000, 3,000 vaccine doses being distributed per day. Now we're really celebrating if we can have an event where we can get like 200-300 people, because the people who had a fever pitch for the vaccine, that's really died down. The demand for it has tempered quite a bit. So we really want to make sure that we're investing in a lot of these areas, like our high traffic areas, like laundromats, barbershops, salons, to make sure that we're getting people vaccinated, that we're doing the outreach needed to get them convinced to take the vaccine. We want to make sure we're working with elected officials like yourselves and other community leaders to identify the prime locations for these. I see a few in the chat that have been mentioned. And also vaccinating minors is one of our high priorities. We're holding clinics at schools. They're being open to students and some of their family members. I had in my notes here, I received some information yesterday at so this past week at Northwestern High School, 198 either students or their families were vaccinated, and 98 were Suitland. And these were all walk-ups. So this was all done with a lot of community outreach. I'm sure a lot of you all had done some outreach yourselves for some of these events, so we want to thank you for that. And we're vaccinating at Bladensburg High School tomorrow, if I'm not mistaken. And a little bit more towards the not too distant future, we want to make sure that equity is also considered in the event that the COVID-19 vaccine that we received this year will require a booster shot at some point in the future. So we're not done by a long shot in terms of just getting one and done vaccines. We need to make sure that equity is also being considered in the future should a booster shot be necessary. And that is just about it for our presentation here. Caitlin, do you have any closing remarks for this presentation?
No, I just, I think that we've been able to partner really well with the private sector as well as our elected official partners. And we hope to continue that as we work through the recovery from COVID-19 with a number of different health areas. So we're just really excited to see this many people, on the phone and interested in this topic. And really thank you for taking the time today to talk to us about health equity. We'll be happy to answer any questions that you have.
Yes.
Oh, thank you for the information, Caitlin and Ryan and Dr. Askew. It's good to know.
The second thing that the doctor showed me was quick.
Oh.
Hello? Do I have somebody background? Okay, so what we want to do now is that if you have specific questions, you can either put them in the chat or you can unmute and ask your questions now. Anybody? Not everybody at the same time. We did get your comments, Todd, about adding the Franklin Park apartments.
Hi, Rhea.
Hi,
It's Malcolm.
how are you, sir?
I'm good. How are you?
Good.
Good. So thank you for all this input. And I apologize, but I've been kind of in and out of this call. But I wanted to understand, at least with me, I've had a lot of coordination. Obviously, we were at the state, but with the National Guard, and they have really done a lot in District 47. Is there coordination with you all and their task force that they have and how they're trying to reach into our community?
Yeah, Senator, I probably talk to General Burkhead once a day on average. And if we don't talk live, we text. And I know that the task force team has been working closely with the National Guard and the Vaccine Equity Task Force at the state level.
So I guess because my question is then with that's been for us in District 47 sort of our go-to as far as getting vaccines and setting up events and stuff like that. I mean, is that sort of the way that we should proceed, or is there a coordination, or what do you think?
Well, what we try to do is make sure we don't all stumble and trip over each other as we're going into different places. One of the things that works with the coordination and conversation is that we don't end up doing work in the same areas. Or if we do, sometimes that's okay, to be in the same area in a high need area. We just want to make sure that we're not duplicating efforts. So I would say, as I say to folks who ask about which vaccine they should take, I say take the vaccine that's first made available to you. I would say, if you have an opportunity or an effort that can be made with one of our partners, to make sure that you take advantage of that, and just make sure that we're looped in, so that we can make sure that we can lend any assistance that we might be able to lend, but also know that that area is being worked on when we're trying to make decisions about where we're going to go next.
Okay, thank you. And Doctor, where is that loop in? Where should we be looping that into?
I would say that the task force, our task force, that would be Ryan and Caitlin. Particularly, Caitlin's played a particularly important role in the community outreach.
Okay, thank you. I appreciate it.
Anybody else? Gosh, no questions, nothing?
Rhea, this is
I do.
Melanie. It's Melanie Griffith. I'm sorry if somebody else was coming in, they can go ahead.
She said, Jocelyn said you could go ahead.
Okay. And I apologize. I was leaving my other job to come over. But I guess I just wanted to, first of all, thank and applaud you all for ramping up and responding to the crisis in the county. And to ask, I know that many of us have been monitoring at a state level. Is there something else that we should be doing, or other pressure points where we should be sounding off at the state level to help with the efforts that are happening in the county?
I think just knowing that we have that avenue to use you as leverage when needed is a comfort. We've actually had a fairly good relationship with the state and are able to get what we need from them. I think as this sort of door-to-door operation, neighborhood by neighborhood continues. There may be extra need. For instance, we thought at one point we might have a need for additional Spanish-speaking folks to engage with some of our efforts. I gave the general a call, and she just said, "We're here. We're on standby. You let us know. Give us the event, and the number of folks you need, and we'll make them available." So for the time being, unless Ryan and Caitlin may have some other ideas of some specific things for right now, but again, just knowing that you've got our back is quite helpful.
Yeah, I would agree and say would just echo that we've had a good relationship throughout this and been sort of mutually helpful. But thank
And
you.
you know, we can always find you when we need to. We definitely will call.
Well, I know just with the colleagues that are on this call, I know you all have the right people in position to help. If you call us, we're there.
Thank you. Appreciate it. Vice Chair Pina Melnick.
Thank you and good afternoon. I want to thank you for the work you're doing, and Dr. Askew, thank you for always being responsive. I would like to suggest, as you are in the community, I know that last week I worked with Dr. Askew. We have had several meetings to organize with University of Maryland Medical System, with other partners like Radio America, who is a trusted source, and United, and Dr. Huerta, Dr. Perales, Katina Rojas Joy from the state. And my daughters and I went out last week and we door knocked with Cecia Fuentes, the executive director of the Maryland Legislative Latino Caucus, 420 homes around the church. And we also I did over 15,000 steps in one day. And then the following day, we did 900 apartments. And we went to laundromats and we went to liquor stores and we went everywhere. And it does work. It does work because right now it's not a problem of not having vaccines, but the problem right now is finding the arms. But I can tell you from door knocking and speaking the language and going out there in 20783 that there are many people that are not vaccinated. Many. So I would advise you in a very gentle, loving, respectful way, if you could find money, and I know that there is money, to hire people that speak the language, that will go out there. There are organizations like LAYC, there's organizations like the Mayan League, and other organizations that can hire young people that are actually not going to be in school anymore. Okay, that you could hire kids from High Point, from Northwestern, from Parkdale, and pay them a little money to go into the community, because my two young adults who are in college, they did all those doors with me and they talked to so many people and it actually worked. We vaccinated 180 people on Sunday at the church. So that is what it's going to take. It's a bit of work, but not everyone, my daughters volunteer because I made them, right? It was a service day for them and they didn't have a choice because they're my kids. But, pay them a little money. It really works. It does work. And in those community, people will go ahead and get the vaccine if you just take a little time to go out there and talk to them. And we talked to so many people that were working in their yards. So thanks for hearing me out, okay?
No problem. Thank you
it.
for the suggestion. And I want to take this time to introduce Allison Flores, who is our new Latina connection in Prince George's County. She started in the office a few weeks ago. Allison, you still there?
Hi, yes, I'm here. Hi, everyone. Thank you so much for the great presentation to the team and for the introduction. I'm definitely here as a resource and to lend help wherever necessary. Thank you.
And thank you for the suggestions, Councilmember Turner, about maybe using the summer youth employment program as opportunities to do that. That is a great idea. And yes, there are handouts in different languages. We have been doing that. Anybody else? Well, if not, anybody else from the county want to say something, like Donna Perkins or Amber?
Donna is the keeper of the data, and see, I've got her working right now on something else.
Yeah, thank you. I actually had texted Dr. Askew with our updates for the county during this call because things just keep looking better and better. We're up to 13 zip codes that are at least 65% of the population have one vaccination. So every time I look, the news is better and better. So happy to share that little tidbit.
Thank you. That's wonderful. That's good to know. Well, now that everybody's contributed to the conversation, I would like to thank our presenters and Dr. Askew for giving us this information. As we know more information, we like to share more information. And as Prince George's County becomes more vaccinated, we like to share that as well. I want to thank everybody for suggestions on how we can hit other neighborhoods, other communities, and in ways that we can do that. If you have any other suggestions after this call, feel free to email us at intergovernmental.affairs@co.pg.md.us. And also, Caitlin has put her email and telephone number in the chat, but I know some of us might not be sitting still and be able to write it down. So we will send a follow-up email from the call to everyone that's on the call. And as requested, probably put the PowerPoint in it, and we can put contact information in it as well. I want to thank you for joining us. Look out for another call, maybe sometime soon. Have a wonderful weekend.
Thank you.
Bye, everybody.
Thank you.
Bye.
Thanks, everyone.
Bye.